In order to get a better understanding of the NHS and local government system, we're going to take each part in turn and look at them in more detail. We will start by looking at the main NHS organisations which operate at the national level. The political leader of the NHS is the Secretary of State for Health, who is appointed by the Prime Minister. When they're appointed, the Health Secretary normally selects up to 3 ministers to support them, and they allocate particular responsibilities to each one, such as mental health or social care. It has been suggested that the Health Secretary is about halfway up the promotion ladder in the Cabinet in central government. One of the possible implications of this is that the post holder may be more motivated to make their mark while they're in office. The Health and Social Care Act 2012 was implemented in April 2013. It led to the first major change, which was to separate out the NHS from the Department of Health. It is now known as NHS England. The Department of Health is much smaller than it used to be and needs to work closely with other government departments. Its main focus has to be on policy and prevention. It has a budget of around £14 billion. Its main agency arm is Public Health England, which focuses on prevention of ill health by looking at the key factors relating to our lifestyles, which can have such a detrimental impact on our health. They run a variety of national campaigns to do with smoking, reducing high sugar diets, alcohol intake and exercise. NHS England, by comparison, has a budget of over £102 billion. It oversees the NHS through a number of regional and smaller area teams. Its responsibility is in effect to run the NHS, which is divided into those organisations who commission or buy the services and those that provide them. About 30% of its budget is held back to run the system and to commission those specialist and other services where it makes more sense to commission them nationally to gain economy of scale. These include rare conditions, prison health services, services for those people with serious mental health problems who require forensic inpatient beds, and services for the armed forces and veterans. But in addition to these, they also have responsibility for commissioning the 4 primary care groups: GPs, pharmacists, optometrists and dentists, whose contracts are negotiated nationally. The remaining 70% is allocated to the clinical commissioning groups to manage, of which there are over 200 in England. They are responsible for commissioning the services to meet the needs of their local populations. We will look at the CCGs in more detail in sections 2 and 4. Although there are estimated to be well over 90 different organisations monitoring the NHS at a national level, the principal regulating organisations are NICE, the CQC and NHSI. NICE stands for the National Institute for Health and Care Excellence. It is responsible for recommending treatments and pathways for patients which commissioners should be buying and which NHS providers should be providing. The CQC stands for the Care Quality Commission. It used to be known as the Healthcare Commission before it merged with the Commission for Social Care Inspection and the Mental Health Commission. Its job is to make sure that the services provided by any NHS and social care provider are of sufficient quality. These providers could include mental health trusts, community services, hospitals, ambulance trusts and GP practices. The CQC rates each organisation overall as either outstanding, good, requires improvement or inadequate. Where services are regarded as inadequate, they have the authority to serve improvement notices or even to close an organisation down. NHSI stands for NHS Improvement. It is the result of a merger between 2 organisations previously known as Monitor and the Trust Development Authority. Its overall role is to be the main economic regulator for the whole NHS system. It has the responsibility to ensure value for money. In other words, to ensure that resources are being managed appropriately and efficiently. It can give advice and support and can step in if particular organisations are in serious financial difficulty. As it is difficult to assess the quality of services unless you look at value for money, and similarly, it's difficult to look at value for money without looking at quality, it is really important that the CQC and NHS Improvement work very closely together. Although they are funded by the Department of Health, they are standalone, arm's-length bodies. So in summary, in this module, we've looked at the main NHS organisations operating at the national level.